How's it going? This is Don Z again here, and in this video we're going to be going over how to read your EOB that you have received from your insurance carrier. So we've probably all received an EOB in the mail, had a minor heart attack saying, wow, that right there is a $10,000, $20,000 bill, only to find the text at the very top that basically says, this is not a bill. So, what does this form mean? Why do you need it? And how do you read it when you receive it? And kind of how are you going to actually utilize this form when you get it? So, here is an example of an EOB that you are able to look through. Okay. Every single provider's EOBs are going to look different, but for the most part, they're going to have all of the same pieces of information, which we're going to dive into in just a second right here. I do want to point out that some EOBs, and I personally prefer this when they have this, they will list out your current year-to-date deductible and your current year-to-date out of pocket. If you want to see what those are and learn a little bit more about those specific terms, feel free to click the link in the description below, and I will teach you about those as well. But let's just dive in here. Every single one of these EOBs is going to have a phone number to the insurance carrier. Take note of that. It should also be on the back of your ID card. And if you have any questions about the EOB, or if you have any discrepancies, you think the doctor put something in wrong, feel free to give that number a call. Very little hold times typically with most major insurance carriers in our country. So the payee is the provider that will be receiving reimbursements for the claim. You're going to see your patient name. You might see your name if your dependent had it. You're going to see the date received, the claim number, which is an important thing to note just for your records, and then the date that everything was paid. And like I said earlier, you're going to see in big terms almost on every single one of these EOBs that this is not a bill, not something that you're having to pay. It's something that is going to get broken down for you. So let's zoom in here just to go over the meat and potatoes of this a little bit more thoroughly. So you will have a line breakdown for every single service that was done. This could be 20, 30 deep if it is a hospital stay with a whole bunch of different items being taken care of. You're going to have a date of service. This could be a range of dates. You'll see here this is listed as 3/20/22. But if you're room and board for a hospital, say for 5 days, it would say 3/20 to 3/25/22. Okay. You sometimes will see this claim status of paid. Most of the time, this is going to be written down as a code, say something like 066. Always look at the footnote for that code. If there is a mistake, that code will say, hey, there was a mistake in this billing. Something needs to be attended to. So make sure you pay attention to that. Better safe than sorry. What you will see here is you always see a very big number. Hospital stays sometimes can see this written down as $20,000. Then you're going to see the allowed charge. So you'll see that the hospital billed the insurance carrier this, but according to their contract, they're only able to charge this. Okay. Then you're going to see how much your insurance carrier pays of this amount. So let's use we'll use this example down here. So provider charges $375. Okay. Now their contract with the insurance carrier says they can only charge $118.12 for it. All right. So according to your plan and your contract with the insurance carrier, you will not be paying more than $35 for this procedure in your copay. So your insurance carrier is going to pay however much of this that's going to cause you to be at $35. So if you add 35 and 83.12 together, you are going to get the 118. All right. Why is this important? All right. You are then going to receive an invoice from your provider for this $35. If you receive an invoice from your provider that doesn't match, you're going to have to give the provider a call, say, hey, my EOB does not match, give the insurance carrier a call, and they will be able to work it out for you. Okay. This is the most important part. Do not freak out about these big numbers over here. It's just how the American healthcare system works. You're going to see how it's being broken down on the insurance carrier, and then you are going to be paying what you owe over here. Only this amount, the what you owe, is being applied to your deductible and your out-of-pocket. This $375 of what the provider originally charged is not being charged to your out-of-pocket. So for this claim and your deductible and your out-of-pocket, you are getting credited $35 to that for your time being. And that right there is how you read and decipher an EOB. After you get this EOB, I highly recommend keeping it in your files, especially until all of these invoices are paid. There could be some big delays on when you receive this EOB to when you receive the invoice from the provider. So just keep that in mind. But as always, this is Don Z. Thank you so much for tuning in and learning about how to read your EOB. Feel free to like and subscribe and share this video with whoever you would like.